right, welcome and thank you so much for joining us. I'm Lauren Lamb, Senior Director of Grassroots Advocacy at First Focus on Children. And I'm here with Felicia Burnett, National Director of Healthcare at MomsRising, and Carrie Fitzgerald, Vice President of Children's Health Policy here at First Focus. We're here to talk about risks to kids' health insurance and how the Caring for Kids Act, a bill in the House right now, can help protect children. If you have questions as we go along, we'll be answering a few at the end, so please type them in the comments below. Before we begin to talk about the ACA and how it relates to kids' care, here's a clip from First Focus's Children's Week of Iowa Representative Abby Finkenauer, the bill's original sponsor, about why we need to make the Children's Health Insurance Program, or CHIP, a permanent program.
And in 2018, I was actually running for Congress at the time, and I was watching CHIP essentially be used as a political football. There was negotiations back and forth on budgets, and they were holding CHIP essentially hostage. And we're talking about children's health. This is not something that should ever be used as a political football in any circumstance. And unfortunately, they actually let CHIP lapse when that happened. And that actually put in, a lot of concern for folks in our state, for our families who were wondering were their kids going to have what they need. And it just should never be that way. So this is something we should be able to come together on, Democrats, Republicans, in a bipartisan way, which I'm glad that this bill is bipartisan, this permanent reauthorization, because it shows our values, right? And that's what we should be talking about in Congress. And this is something that needs to get done. And again, needed to get done actually for many years, but we will move ahead now and not stop till we get it done.
Hey everybody, thank you so much for joining this webinar today. I'm Felicia Burnett, National Director for Healthcare at MomsRising. We're an on-the-ground and online grassroots organization of more than 1 million people who are working to increase family economic security, decrease discrimination against women and moms, and to build a nation where both businesses and families can thrive. MomsRising is proud to champion the Caring for Kids Act because nothing is more important to us than protecting children's health. And the Children's Health Insurance Program, which is also known as CHIP, has been providing coverage to America's children for 23 years. This program is popular, bipartisan, and one of the most cost-effective healthcare policies in place in the United States today. And it currently provides robust pediatric-centered coverage for about 10 million children whose families make too much to qualify for Medicaid, but not quite enough to be able to afford private health insurance. And CHIP is a lifeline for these families. For no good reason, really, CHIP is the only federal health insurance program subject to expiration and the need for offsets, meaning that each time Congress reauthorizes it, members need to find money to continue it from another government program. At MomsRising, along with our allies, we're asking Congress to make CHIP a permanent program. Doing so would give millions of families the peace of mind that comes with knowing their children will be able to get the health care that they need. And in the midst of the COVID-19 pandemic and the economic devastation and massive unemployment it's brought, nothing could be more important. You can just ask Melissa. She's a MomsRising member here in Charlotte, North Carolina. Melissa had worked for 5 years at the same company before her job was outsourced overseas. And when that happened, she lost her health benefits. At that time, she had a 5-year-old son and was pregnant with her second child. And one night, in what Melissa says is the scariest moment of her life, her son woke her up saying he couldn't breathe. She rushed him to the hospital where he was diagnosed with a condition that would require ongoing treatment and medication. And the hospital helped Melissa apply for NC Health Choice, which is North Carolina's CHIP program. This low-cost coverage enabled Melissa to access the care that her son needed to live a healthy life. And she says, even though I'm working again, the coverage for my family would cost 1/4 of my paychecks. That's something I cannot afford. So without the NC Health Choice program, we would not be able to survive. Melissa is not alone. Millions of families rely on CHIP to keep their children healthy and in some cases to help them survive. CHIP is proven, it's cost effective, and it gives millions of children the health care that they need. At the same time, the Trump administration and Republican state attorneys general have continued their fight to undo the progress that was made through the Affordable Care Act. Even now, as families contend with the COVID-19 pandemic, and even as a new open enrollment period just began, the attacks on the Affordable Care Act have continued. Just last week, the US Supreme Court heard oral arguments in California v. Texas, which is a case that would end the Affordable Care Act. But it's not just a threat to people who have coverage through their state's insurance marketplace. It's also a threat to the 10 million kids covered by the CHIP program. According to a March 2019 analysis by the Urban Institute, full repeal of the ACA would cause enrollment in Medicaid and CHIP to fall by 22.4%. So now we must stand up for kids by demanding that Congress make CHIP a permanent program. Losing the ACA would be an absolute disaster for this country, and it could have a ripple effect on the federal budget that threatens the future of CHIP, making it much more difficult for Congress to renew this essential program in the future. Unfortunately, that's a battle that we've had to fight before. In fact, in 2017, Congress allowed CHIP to expire for more than 4 months. And we just cannot let this happen again. So children's health should never be in jeopardy or used as a political bargaining chip. No family should have to worry that their child will lose essential health coverage. So that's why we're co-hosting this webinar today with First Focus. And we're asking you to contact your members of Congress, your senators and representatives, and ask them to support the Caring for Kids Act, which would make CHIP's health coverage and contingency funding permanent. There will be more info on how to do that later in this webinar, but this bill would protect millions of families and children from political gamesmanship and uncertainty. Let's not gamble with the health of children, with the health of 10 million children and their families who rely on it. Let's demand that Congress pass the Caring for Kids Act now. And now I'd like to introduce Carrie Fitzgerald of First Focus to share more about what making CHIP permanent would mean for families.
Thanks so much, Felicia. I appreciate your introduction and all that you said. Felicia is absolutely right. The CHIP program right now, at any given time during the year, up to 10 million children are covered by CHIP. CHIP's been around since 1997. So it's getting close to its 25-year anniversary. There are children who were on CHIP who are now in their 30s. They're grown-ups. When we think about this bill in particular, and we think about making CHIP permanent, this is exactly what children need. It's what children deserve. It's like the Medicare program. It's like Medicaid. It's like TRICARE. It's like Veterans Health. All of those programs are permanent. Those advocates don't have to come back every year and ask to get CHIP funding, as we have done. And I know many of you have helped us over the years advocate for CHIP funding. This bill does more than just make CHIP permanent, though. This bill also includes express lane eligibility, which improves enrollment and helps kids get enrolled even when they apply for WIC or free and reduced lunch at school. It helps them get into the CHIP program. It funds outreach and enrollment grants, which are the ways that families hear about CHIP and find ways to get their kids covered. It includes pediatric quality standards to make sure that kids are getting the actual care they need when they go in. There's a lot of really good things in this bill beyond making CHIP permanent. It makes the whole good, solid CHIP program permanent. And the reason that we need to do it is because we have, over the decades, have had to go back and back to Congress asking them to fund CHIP. There have been times in the early 2000s when states had what we called funding shortfalls. I was in Iowa during that time when there wasn't enough money for CHIP. We didn't know if it was going to last. It was just some states were going through that, not all the states. So it was hard to get Congress's attention during that time. And then, of course, we had in 2015, we had to get CHIP reauthorized. That was a long, hard-fought battle. And then the most recent one in 2017, when CHIP went unfunded for 4 months. And during that time, we saw states send out disenrollment notices. There were a lot of headlines across the country that CHIP funding had gone away. That's really confusing to families when they aren't sure if perhaps they're at a point in their lives when they could use CHIP. Maybe there's been a change in coverage at work or a job loss or a decrease in income, and they want to go into CHIP, but they don't know if it's going to be there. Families were unsure if they should keep paying their premiums. Should I pay my CHIP premiums if CHIP isn't really going to be here next month or next week? There were a lot of headlines across the country about CHIP going away. It was a really tough time for families and for medical providers. We've heard a lot of stories from medical providers about how difficult it was at that time when families would come in and say, could I please have 3 months worth of medication? How much, can you skip the next appointment? What can we do? That was a tough time, and children and families should not have to go through that. And again, it's the only federal program that requires ongoing funding and reauthorization. CHIP is a huge success. It's been a bipartisan success the whole time since it's been created. It's popular in states, it's popular with governors, it's popular with state legislatures. There's absolutely no reason why it shouldn't be made permanent. This bill, sponsored by Representatives Finkenauer and Buchanan, would end this problem, and it would make CHIP permanent. Advocates like us and like you who reach out to Congress would be able to reach out and do different things, have different asks. You'd be able to focus on more things for children and families. Maybe you'd focus on infant maternal mortality or health disparities. We wouldn't constantly having to go back and ask for the same thing. So when we ask you to do this, we think this is incredibly important and meaningful for children and families, for state budgets, for all of us, for our time, for the permanency of children's health care at the state and local level. We really hope that you will take the steps that we're asking you to take in the next few minutes, and we appreciate you being here. Thank you. And now we're going to hear from a mom brought to us by MomsRising to tell us about the importance of CHIP to her family.
Hi, everyone. My name is Erica Banks, and I'm a mom from Elizabeth City, North Carolina. I have 2 children, ages 16 and 12, and both get their health insurance through NC Health Choice, which is North Carolina's health insurance program, or CHIP. One of my children has a mild intellectual disability, and the other is on the autism spectrum. Coverage through NC Health Choice has been really important for my family specifically. Because of the partnership they have with Trillium, it has been easier for us to access necessary mental health care services. One benefit that assists the most when it comes to these services are low-cost copays. During the COVID-19 pandemic, it has been especially important for us to have insurance through CHIP, because having health insurance coverage has granted my children the behavioral health treatment and services they require for their individual needs. I remember in 2017, when Congress let the CHIP program expire for 4 months, my family felt discouraged, not knowing if we would be able to continue to receive necessary treatment to prevent disease and promote oral health. It's important to me for Congress to make the CHIP program permanent, so that my family and all families who benefit from the program will be able to keep annual well child visits with the same provider, receive age-appropriate vaccines, and attend sick visits as necessary without having to go to the emergency room and receive large bills that they can't afford. So please join in on the actions that you will hear about in this webinar today to make CHIP permanent with the Caring for Kids Act.
Thank you so much for sharing your story. The story you just heard underscores the reality of programs like CHIP. It impacts families' everyday lives as they care for their children. Making CHIP permanent isn't a radical move, and Congress can do something to end this uncertainty. It takes just a few minutes to tell your member of Congress to sponsor the Caring for Kids Act. I'm going to walk you through how to take action right now. Using the link in the email that you received this morning, you can go to First Focus Campaign for Children to support the Caring for Kids Act. On this page, it shows you a pre-filled message that you can send to your representative just by entering your info. You'll enter your name, your address, that's so that we know which member to send this to, and review the message that we've already written out for you. If you want to add a personal touch or a story or an anecdote, you can do that. Otherwise, you can just send it off. This will go right to your member's inbox so that they know how important it is to you that they take action. Thank you so much. We're going to be taking some questions now from the audience for Carrie and Felicia. Our first question is, if CHIP were to expire in the future, could the kids previously covered by CHIP go into Medicaid?
Not necessarily, because they're in CHIP because that's what they qualify for. And they qualify for CHIP due to the financial eligibility regulations and guidelines in their state. And so some kids qualify for Medicaid based on family income, and other kids qualify for CHIP. So they wouldn't necessarily get to go into Medicaid. They may be uninsured.
Thank you, Carrie.
Mm-hmm.
Our next question is, if the ACA is repealed, would CHIP automatically end?
It wouldn't. It wouldn't. And we don't want to scare anyone that it would. That's not really what we're talking about today. CHIP's here until 2027, but we're in this window of time right now where the ACA is being discussed and healthcare is being discussed, will be discussed in Congress in the next session, where we could make CHIP permanent because of this bill, and also because of some of the ways Congress is figuring out how much it costs. This is a really good opportunity right now to make CHIP permanent in a way that it wouldn't have a huge price tag. But I don't want anyone to think CHIP's going away right now, because it isn't. We just have this great opportunity right now to make it permanent once and for all.
Thanks, Carrie. All right, our next question is CHIP coverage dependent on immigration status?
It is. It is. States have an option that they can take to cover. The simple way to put it, because immigration terms are really complicated, what's defined as lawfully residing children and pregnant women. If states take that option, those children and pregnant women can have coverage right away. If they don't take the option, lawfully residing children and pregnant women have to wait 5 years for coverage. And we always say 5 years for pregnant women, that doesn't make any sense. 33 states have taken that option. So we're way past the tipping point now that most states do it. And there are a few states, I think it's 5, who even cover undocumented children, and they use state funds for that. They don't get any federal funds for that, but they use their state funds for coverage. We always say 5 years. We would like to get more children, more states to take up that option, for sure. We would love to get all states to do it.
Great, thank you. All right. And our next question is, what is the argument against making CHIP permanent? Why hasn't this happened already?
No, I don't know that there's an argument against it. I think it's, to be honest, political will. And, you know, this was an interesting bill. This was a fun bill that was introduced last year. We were like, hey, somebody wants to make CHIP permanent. That's great. So it's, you know, to be honest, and I think Felicia can talk about this a little too, in a lot of their advocacy, it's some of how do we raise kids' issues up? How do we get people in Congress to really focus on kids' issues and the issues that families, moms, kids face? And so I don't think anyone is like, it should never be permanent. I mean, there may be a few people, but they're not loud. I think it's really kind of political will. I don't know, Felicia, what you might think about that.
Yeah, I think definitely that's a big part of it. And we know that, like, especially parent stories like Erica's story really has a lot of sway when we're talking with members of Congress. We've delivered storybooks on CHIP several times in the past, and we always hear from staff on the Hill that they've learned something new about the program. So CHIP is a relatively new program compared to Medicaid and Medicare, and there's still a bit of a learning curve happening with folks on the Hill, and so they don't really fully understand how critical it is for families. So the more that folks who are watching this and people out there can contact their members of Congress and let them know the real impacts of the health policy on their family, the more education they get and the more that they understand what a critical program it is and why it should be made permanent.
Mm-hmm. Exactly. I don't think there's anything more valuable truly than those stories. And honestly, sometimes when, like, if Felicia and I we have gone together into offices, we may say CHIP, Children's Health Insurance Program, and that office may know it as Badger Care or Peach Care or Apple Care or Hawkeye. They know it as their state program because every state has named it something. So when they hear from a constituent, a family, a mom, and she says, my kids are in, Peach Care, that even has a little more resonance in that office, and it's something they can be even more familiar with.
Thanks, Carrie. Thanks, Felicia. We have a comment from the audience from Hillary that says, CHIP really helped me when my daughter was a baby. She's 18 years old right now.
Oh, I love that.
Yeah, and sorry, Carrie. Like, we have heard so many stories from people who have benefited from CHIP who are now adults and no longer on CHIP, but are just so grateful that that they were able to use the program to help get their healthcare needs met. And it's not like only people who have like critical medical needs. It's even just for your annual well child visits, or to, when you get sick, to be able to go to the doctor and not have it put your parents in a position of getting you the care that you need or buying groceries that week. CHIP really relieves the economic burden on families, and it creates an atmosphere for kids to really be able to grow up and be healthy adults. And it's been really cool to see the generational impact of this pretty new program.
It really is. And I think about, I remember when I lived in Iowa when CHIP first started, and some of the things parents would say is, there was no program, there was no insurance beyond Medicaid. There was this huge gap with kids uninsured, and parents would say, I didn't let my kids play on sports or go sledding. I was trying to protect them from any injury because we didn't have coverage. And so even something as simple as it lets parents feel safer letting their kids go out and do some things that might involve some risk. They know they're covered. So important.
Yeah, and one thing that I want to add about the ACA coverage is that a lot of parents who have ACA coverage have children who are on CHIP. Mm-hmm. So, and we know from experience that when parents are covered, that kids are more likely to become covered. So even if the ACA is repealed, children's parents will lose coverage, which is really critical, we know, for children's health. But also they're also more likely to become disenrolled in CHIP because the parents won't understand that one doesn't necessarily always impact the other.
Right. And kids get picked up into CHIP and Medicaid when their parents are interacting with the ACA system and getting themselves enrolled. So it's a great kind of what we call a welcome mat for kids to come in. So it will definitely hurt kids if the ACA is repealed or done away with. So that is a concern for us. Chip will remain, but it could be harder to find some of the kids and get them in.
Great. Thank you, Carrie and Felicia. We have one more question here. This says, how is CHIP coverage different by state? Can you say a little bit more about how that varies, like Peach Care?
Sure. So states can choose the income level, the family income level for eligibility. So they can go up to 300% of poverty. There are 2 states that get to go up to 400%. Most states are between 250 and 300. States can pick the immigration status coverage, and they can also they can pick some things like if they charge a premium and how much. They can pick some benefits. They have some flexibility there. They can decide how long a child has continuous coverage. So maybe you enroll in CHIP and you're covered for a year, maybe it's 6 months. So they have different flexibilities. So we work with advocates around the country, as I know Felicia does, to continue to bolster those options in states so that state legislators and governors hear what families really need in their state too. That's really important at the state level.
Great. Well, thank you so much, Carrie and Felicia, for being with us today. It was great to hear from you and great to hear from Representative Finkenauer and families as well.
Thank you.
Yeah, thanks for having us.
And as a reminder to our audience, you can take action at campaignforchildren.org /HR 6151. That is the House bill in the House right now. And like Felicia said, hearing your stories is so impactful. So please feel free to add a personal touch to that message.
Great.
All right. Have a great Friday, everyone.